Hi, my name is Kobe Langley. I'm a Senior Vice President for Servicing Armed Forces at the American Red Cross. These past 6 months with CMSI have been exceptionally insightful as to the financial needs of veterans and military families. The Red Cross provides millions of dollars in financial assistance with our military aid societies, and we're seeing an increased focus on financial needs and readiness for our military families. So I want to say thank you to CMSI, and I also want to introduce you to Mike Neese, who's working on the Financial Assistance Work Group for Veterans and Military Families. Mike, take it away.
Hello, I'm Michael Meese, the president of Athma, the American Armed Forces Mutual Aid Association. I had the honor of being one of the facilitators of the COVID-19 Military Support Initiative Working Group that examined financial impacts on the military family. Our group included 45 experts from government, the military, corporate, and nonprofit sectors, including leaders from the DoD, the VA, and several military relief societies. While we covered a lot of ground, I'm going to summarize our findings in 4 major areas: the military checkbook, the stop movement order, spouse employment, and finally, military child care. The first, somewhat surprising observation is that not all impacts were negative. For example, nearly all military families qualified for a CARES Act check from the federal government. A military family with a spouse and 3 children, for example, received a $3,900 check, which is a significant windfall that not only helped families deal with the COVID crisis, but improved their overall financial readiness. We saw this effect as measured in the CMSI pain points polling. The number of families who reported using credit cards to cover necessary expenses during the crisis fell from 44% in week 1 of the polling in March to only 20% by week 10 of the polling in May. Similarly, while military relief societies, which were highlighted during the second CMSI town hall meeting back in April, stood ready to provide assistance to military families, Army Emergency Relief and Coast Guard Mutual Assistance reported that requests were actually less than they had anticipated. One area of negative impact, however, was Secretary of Defense experts' 25 March 2020 stop movement order that dramatically affected thousands of military families in the midst of a move. Families reported military financial hardship due to the fees incurred from breaking or extending leases, money lost from halting the sale of a house, double mortgages due to travel restrictions, and loss of down payments or deposits. Some families faced extra costs when their vehicles or household goods had been shipped prior to the order. As DoD implemented programs to address the effects of the stop movement order and military families understood their circumstances better, family anxiety and the financial burden lessened. For example, the number of families reporting unexpected out-of-pocket expenses as a result of rescheduling a PCS fell from 27% in week 1 to only 8% in week 10. Similarly, those who reported that they would be paying 2 leases within 60 days fell from 21% to 12% by week 10. Although it had an impact on those PCSing, stop movement also affected those who were staying in place. The Pain Points poll reported that over half of military families had to cancel participating in a life event, such as a vacation, graduation, anniversary, or wedding, due to the stop movement. This resulted in a loss of money, causing both financial and emotional stress. Beyond the stop movement order, military spouse employment, which is always a challenge, was magnified under COVID-19. Some military spouses were laid off, others had to balance job requirements with children that are newly at home, and still others had to find childcare when both spouses were deemed essential. The Pain Points poll reported that 17% of those who had been employed prior to the pandemic reported that they had lost their job or were unable to work. Now, one silver lining of the COVID-19 crisis is that the general population has learned something that many military spouses already knew. Remote work actually does work. The COVID-19 remote work surge could benefit highly mobile military spouses that are already accustomed to working from home. Finally, closely related to spouse employment is the need for childcare. The COVID-19 crisis exacerbated a problem that most military families already knew. Childcare, either on or off an installation, is hard to acquire, difficult to afford, and can be a significant stressor to working parents. During the 10 weeks of the Pain Points poll, 17% of civilian and military mission essential personnel surveyed were unable to find or use childcare. Although some could find childcare, as many as 54% of the respondents said that their family was currently unable to use their previously normal childcare provider. This creates stress for the children, parents, and providers. Based upon looking at these four areas, we came up with some important takeaways and policy recommendations. I'll just highlight 6 of them. First, military families must develop the tools and discipline to save, prioritize spending, and thereby lessen the financial effects of any catastrophic event. Simply stated, financial resilience is readiness. Second, such financial training needs to be holistic, with a communication plan that includes relief societies and forums with spouses so that military families can both take advantage of windfalls and avoid financial pitfalls. Third, military services and community organizations should have the resources, policies, and procedures to help military families logistically and financially in the event of a future stop movement scenario, whether that's for a worldwide pandemic or a local stop movement condition. Fourth, employers should understand which employers are also full-time caregivers and or hybrid homeschool teachers so that they can facilitate flexibility in work schedules. Fifth, there needs to be programs to support technology and internet access for those military families who do not have it, and that would support both remote workers as well as children's education from home. And finally, DoD policies should treat care providers as essential, especially as they care for the children of mission essential workers. Overall, government, private, nonprofit, and relief societies work proactively to respond to the unanticipated and unprecedented challenges of the COVID-19 crisis. By discussing the lessons learned about checkbook issues, stop movement, spouse employment, and childcare, we can be better prepared not just for a possible pandemic, but for all the other challenges that stress the financial readiness of military families.